So here's what we do. We simply lift the chin and guide forward. Now let his head drop back. So now you want to drop his head back? So what you do is just put your chest up. Yeah. Right there. Yeah. Simply lift, guide, and stop. Right there. Stop. That's perfect. That's it. That's it right there. It's a very slow, subtle step, but once that patient stops, it's there. Now, I'm going to set up on you. I want you to feel what you're doing, and then you can give feedback. What it feels like. Okay. Here's step number one. Bring you back up to neutral. Notice how I'm touching. Okay. I'm quite certain that Dr. Wood will stand about like I am right here. It's been more than 30 years since we've been together, but I'm quite certain because those were my two mentors. They stand up there close. Some doctors like to stand back like this. I can tell you Dr. Pete O'Hara, Denny O'Hara, who you know, will stand back like this. Okay? Doesn't make him wrong, just makes it a little more difficult to adjust with your hands out away from your body than it is with your in a neutral position. Standing up, I mean, I like to adjust just like this. I'm never tired at the end of the day. I adjust 60 or 80 patients like this. This is all I do all day. I adjust a little back, and then I'm done. Nope, straight on my shoulder. Okay? I got into chiropractic because of a shoulder injury, and I still have great shoulders after 30 years. Okay, so that movement is the chin. Bring the patient back up to neutral. Okay. Here's what you should feel. See how it stops? Okay. Now notice where his head is. His head looks like he's still neutral. What he's not is tip the head backwards. That's when I hear doctors describe this step as tip the head back, I want to slap him. No, I mean, you're really not tipping the head back. You're guiding the bone forward on the one you want to set. That's a subtle. Now, how heavy am I on this? You feel how light I am? That's how light you should be. So he'll tell you if you're too heavy. Okay? All right, doctor, I want you to do your step number one on your own. Now, by the way, let me address that. Remember, one of the rules of adjusting is you got to be relaxed, right? The principle, this is a principle, the principle of relaxation. The patient needs to be relaxed as well as the doctor needs to be relaxed. If either one of you are tense, it's not going to work. So when you are at quote-unquote tension, you're violating the principle of relaxation. We don't adjust patients at tension. We will reach tension as we're developing the thrust, but we don't reach tension and stop, hold it, skip the photo finish, and then thrust into them. That's going to be painful, very painful. You violate rule number one, right? Okay? So, the principle of relaxation for the patient is that they're sitting straight up as vertical as they can, meaning their butt's all the way back in the seat and their feet are out in front. Okay? I'm going to tell you right now, if you think about it, if the feet are like this, they're tense. If their feet are like this, they're relaxed. If you don't believe me, the next time you drive in a car and you start falling asleep, take a look at what position your body's in. Slouching and slumping into the chair. You're about to fall asleep. This is when you relax. So if you're falling asleep, what do? You sit up in the chair and you get more alert, right? Alert and relax are two different things. So learn that right now with adjusting. Start off with your patient in a relaxed position. Feet all the way out in front, okay? That's why I corrected this here. And I'll step around your feet.
Wait, are we stacking or just sitting down? Oh, because he's a reflection.
No. Okay. Somebody's taught you the stacking concept. Notice I never use that word, have I? Okay, because that's somebody else's technique, somebody else's way, and it's not wrong, it's just different. Okay, so I don't want you to stack. What I want you to do is exactly what we said. Very loose, light contact. Okay, just place your hand here and just gently bring it back up to the front. Just one hand drops head back, so yeah. Put your thumb right. That's what I want you to do. Now, his head's forward to his shoulders, so what you do is bring the whole head back towards you. Right? asking. It's like a subtle change.
Instead of
Yeah. What you're going to do is with this finger, this is like how you do it. You simply lift a little bit with the chin.
you're bringing it
Yeah.
that.
Yeah.
It's just not like you're not really attractive.
The stacking idea introduces tension into the spine. So that's why it's a match with my philosophy.
I don't know if it's the right word, but you said like have them so it's on top.
Maybe there's certain people who teach stacking on the spine.
That's what we were taught to.
Yeah.
So
Yeah, that's why.
I figured it was similar.
Okay. Would you like me to address that?
Yeah.
Just to make it clear.
Because that's what we learned.
Please turn the video off. I don't want to make anybody. I don't.